You've probably been told never to pop a blister. Leave it alone. You'll make it worse or cause an infection. My opinion, get it popped. Go on, pop it. But only certain types, and do it properly. I'll explain everything, just give me 3 minutes. Blisters are very sore and painful. They're essentially a pocket of fluid or plasma that has collected under the skin. There are different types. The most common are friction blisters and blood blisters. Blood blisters are just friction blisters that have blood mixed in with the plasma. Friction blisters are caused by continuous rubbing or pressure, commonly found on the feet due to poor fitting shoes. Usually, padding is recommended to cover the blister and protect it, essentially removing the source of friction, allowing the body to reabsorb the fluid and heal, usually draining in a few days and fully healing in a few weeks. If the friction source is not removed, it will pop by itself, usually with a larger area of damage. If you pop a blister in a controlled, sterile manner, you can drain it with less trauma to the skin, relieving the pressure and helping with the pain. It will heal quickly once the fluid has been drained. You can leave it alone, but must use a sterile plaster or dressing in case it bursts. Now, I have recommended popping friction blisters if and only if painful and bothersome. The following should absolutely not be popped whatsoever. Viral blisters, for example, chickenpox and shingles. These are tiny and contain fluid that's highly contagious, which could be spread to the surrounding skin or to other people. They usually occur in crops and absolutely should be left alone. Mouth ulcers. These are painful ulcers that occur in the mouth, usually on the mucosal membrane. They should be left alone to heal. The mouth contains millions of bacteria and it's never a sterile environment. A protective barrier, such as oral-based paste, is my preferred treatment for mouth ulcers. Burns. Blisters occurring due to burns, such as sunburn or heat or chemical burns, should be left alone. Cover with a sterile dressing and seek medical advice if blisters are large or the area of damage is bigger than your hand. Thanks for sticking with me this far. The best bit now, how to pop. It's tempting to just grab anything you have and pop it, but please don't. Wash hands with soap and water. Wash the area surrounding the blister and wipe with alcohol or an antiseptic solution. There are 2 ways to disinfect your sharp needle, heat or chemical disinfection. You could soak in rub and alcohol, or alternatively, put in boiling water for 20 to 30 minutes. It's not a good idea to use salt water or bleach, they're just not effective enough for this purpose. Now you are ready. Here we go. Poke a single hole gently near the outer edge of the blister, 2 if needed, the less the better, but don't go in the middle or the top. It's just so satisfying but disgusting at the same time. Press down then with a sterile gauze gently and keep the skin of the blister intact and pressed against the bottom layer of skin. It will be needed for the healing stages. Now you may need to repeat this because they sometimes do fill up again, but just keep an eye on it. Then apply gauze or a sterile dressing and leave alone. You're good to go. Keep an eye on it. Just look out for any redness, infection, smell, soreness, swelling. If you've done this properly, the risks of this will be so low, don't worry. But does that feel better?